Hey everybody, my name is Brian Joves. I'm one of the doctors at Spine and Nerve Diagnostic Center, and today we are going to be talking about some lateral hip pain. This pain is a very common thing that we see from a lot of our patients and from people that get referred to our practice. Usually we could describe this pain as gluteal tendinopathy. What that means is that we have these muscles that come from our low back and our buttocks across and attach to the sides of our hips. As they attach to the sides of our hips, that's where we have all of these muscles coming together, and they can get irritated over time. A lot of times that's referred pain coming from the low back. The facet joints and the sacroiliac joints are common places that refer to the sides of the hip. But over time, these muscles can become very, very irritated, kind of like the rotator cuff, but of the hip. So as we're trying to get people feeling better, especially during this pandemic, we really want to focus on some of the ways that we can specifically target those muscles. Eventually we'd like to get you back in and really focus on the low back. But for now, one of the things that you can think about is two specific exercises that I want you to do. First, find a place where you can find a nice balancing act, and then just gently kind of come back. And how I want you to come back is at a 45-degree angle, not straight out to the side and not straight backwards, because those are going to activate the muscles differently. But if you come at a 45-degree angle, what you're going to find is you're activating this hip muscle here. And as we activate that, and then really we want to contract and then bring it down nice and slow. And what that's going to do is start getting the blood flow into those muscles and activating those muscles so that we can really start improving the way that those muscles are feeling, okay? The second one is nice and low, get onto a table, and really just do a nice little plank backwards, right? So we want to lift our bottoms up off of the table, activate that, and try to hold it there. And over time, you can kind of work on building that up. As you get stronger, the goal is going to be that you can end up doing one with the leg up, right? That's really going to be stabilizing and building up those muscles. And so with those two simple activities, our goal is going to be to build these muscles slowly over time so that we're not causing increasing pain, but that's going to make those lateral hips feel a whole bunch better. And then we can really start focusing on that core. All right? Stay tuned for more educational information here at Spine and Nerve. See you soon.